This is Bob Riley, and this presentation is part of a workshop on the CDPAC Framework for Action for Integrated Chronic Disease Prevention. The session was kicked off with some introductory remarks by Deborah Lankowski, the Chief Executive Officer, Canadian Public Health Association. And Deborah reminded us of the main objectives of this session, which were to rekindle awareness of the CDPAC framework, learn more about the framework, and particularly examples of how it's been used, create a forum to generate ideas about how the framework could be used going forward, so building on the existing uses, and then to gather some ideas on how application of the framework could in fact be supported. So my job is to give a very brief overview of the development process for the CDPAC framework, and then describe the various components, including the vision, and also the four interdependent components of the framework, including the resources, capacities, action, and impacts. The development process was guided by three main parameters. The first was to ensure that this was a framework for population-based approaches to primary prevention, i.e. going to have the greatest impact on population at large, to reduce major behavioral and environmental risk factors and conditions, and also that the framework was to be informed by best available evidence and Canadian experience and realities. This third parameter was very, very important, and CDPAC recognized that the evidence that was most important to bring to bear was certainly the peer-reviewed and grey literature around comprehensive and integrated approaches to prevention, including examples from tobacco control, heart health, mental health, drug use, etc., but also the experiences of groups within Canada. There were several milestones that were accomplished as part of the development process. CDPAC did a very, very extensive and systematic process to arrive at the framework. First, starting with some background papers to take the pulse a little bit across the country around what were some of the main frameworks and ideas that we thought would be most important in terms of bringing a national framework forward. Conducted a consultation near the end of 2007. Then there was some reframing that was done. The initial trigger for thinking about a primary prevention framework was at the time when a number of disease-specific strategies were being developed. So the cancer strategy, the heart health action plan, the lung framework, etc. And at first, the effort was to see how at the prevention end of each of these frameworks, how there could be opportunities for collaboration and synergy identified. The reframing was that the CDPAC framework was not to just look at collaboration and synergies with these disease-specific and risk factor-specific strategies, but to go beyond that, to think about an overall chronic disease prevention strategy for the country. After that reframing, then there was a draft framework put together by John Garcia and myself. There were interviews conducted with key informants, including those people most involved in the various strategies, and also with members of CDPAC, and culminating in the endorsement from CDPAC in June of 2008. So moving on to the description of the framework and starting with the vision. This verbal captures some of the main words that are part of the vision, and the overall vision for the framework starts out by saying Canada is a society that values health, equity, and sustainability. Within Canada, there is a coherent system and plan to prevent the chronic diseases that exact an unconscionable toll on the health and quality of life of individuals, families, and communities. The vision goes on to talk about the importance of being goal-driven, evidence-based, championed by many organizations and individuals, and also having leadership for a coherent plan, and also for the both system and plan going forward. Now I'll move into the various components of the framework. This slide simply shows the framework at a glance. And the framework itself, as we'll see on the next slide, is actually more linear in its presentation, even though there are the two-directional arrows and the interdependencies among the components is emphasized. But this slide is simply to show at a glance the real essence of the framework, that at its core we are wanting to, CDPAC is wanting to prevent chronic disease, to do that through prevention. And the main elements within the framework answer the key questions of why, how, what, and who. And what we'll see in the framework is that those are represented by impacts, capacities, action, and resources. This is the more linear, and I could have also said detailed, presentation of the framework. You can see the four main components of the resources, capacities, action, and impacts. And the detail under each of these components is what's described in the document that is on the framework for action. So these components are interdependent, and what is unique about this framework, there's no perfect framework, we all know that, but what CDPAC really wanted to do was to go beyond the intervention cube, which is represented here in the third space, the third column, and that's the action that's taken on risk factors and conditions, and then the desired outcomes or the impacts from that. Those are the components that are typically part of various frameworks. What's often neglected and yet known to be important are the resources from different levels, sectors, and types, and also the different capacities. So we'll just walk through these each in turn. So starting with the why of the framework is the impacts. What is it that we're trying to achieve with the primary prevention framework for action? And CDPAC wanted to emphasize the importance of making a difference on risk factors, socio-behavioral, physical, physiological, so at the individual and broader levels, and the risk conditions, very importantly about the environments that support health, cultural, socioeconomic, etc., and ultimately on chronic diseases themselves, be it heart disease, cancer, diabetes, lung disease, kidney disease, morbidity and mortality from those chronic diseases. So this is the why of the framework. And what is it that can impact on these risk factors, risk conditions, and chronic diseases? It's the different actions that can be taken. And the actions that CDPAC wants to emphasize based on the literature, based on what we know is important to make a difference, are the actions that are done with and for priority populations, so groups like children and youth, women, young males, new immigrants, many others who have needs related to chronic disease prevention, and of course the population at large. And where these groups carry out their daily lives, work, live, recreate, play, are in different settings, the home, the school, the workplace, the community, etc. So that's another aspect of the action framework. And then how is it that, or what is it that's actually done with and for various populations and in these settings relate to different components of education, helping to shape healthy environments, and also policy change. So moving one more step upstream, we move to the capacities within the CDPAC framework. And this really is one of the most unique aspects of the framework, to make all of these different capacities explicit. Capacities is a very general term, as we all know, and can be fairly all-inclusive, and what CDPAC wanted to do was really articulate, just define what some of these different capacities are to help us move to the cube-based action. So what you see here are a number of the different capacities that relate to capabilities, skills, knowledge, resources, etc. for taking action at an organizational level, different types of information, and also knowledge. And the most upstream component is the resources required. And these resources were, in the framework, are named as three different categories. There's different types of resources, levels, and also sectors. And you can see on the slide here that the different types of resources, money, people, ideas, and intellectual. The different levels, we've got the different jurisdictions, right from local through to ideally international. And different sectors, the public or government sector, non-government organizations, and also the private sector. In sum, the CDPAC Framework for Action is to be considered an overall public health strategy for chronic disease prevention in Canada. CDPAC is the developer and the keeper of the vision and the framework. CDPAC is interested in building and communicating examples of how the framework has been used, and the workshop at CDPAC and the presentations to follow mine were to bring some of these examples to light. Lastly, CDPAC is interested in finding out how how application of the framework can actually be enhanced, what kinds of supports might be needed. That concludes the overview, and we'll now move on to hearing about some of the examples of how the framework has been used.